For everyone who pulled together from a distance. For everyone who stayed in and stayed out. To those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I miss the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season, and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you because you can't protect yourself. Because I will do anything at all costs to protect my daughter.
Getting the COVID-19 vaccine for me will be a huge priority. I want to do everything that I can to keep my staff healthy. It's really just the only option to resume normal life.
Walking through to the chair where the vaccine was felt like a hero walk. And I feel that everyone who is going to receive the vaccine is gonna get that feeling. You know, that split-second jab represented so much hope.
I have my sticker that says I did get my vaccination. I deal with COVID face-to-face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
We all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
It's been really difficult lately. It's hard to teach with a mask on and not being able to project your voice. It's hard to not see the kids' expressions on their faces.
I want this needle to help me to live for a while more so I can enjoy my grandchildren and go big berries and go have fun.
I miss coming to the game. When it's time for me to get the shot, I'm gonna go sit down in the chair and close my eyes and tell them to stick me.
It's going to save not only my life, it's going to save lives of the people around me, the babies that I care for, my grandchildren, my parents. It will be so nice to not live with that fear.
I think I want to get back to being a 27-year-old, right? Back to having something to look forward to, the regular stuff.
The job is very rewarding. Every day you get a chance to help people. I got the vaccine because I would like to be protected, and at the same time, I would like to protect other people too.
For everyone who pulled together from a distance. For everyone who stayed in and stayed out. To those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I missed the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you because you can't protect yourself. Because
Today's
I will do
COVID-19 update will
anything
begin
at
in
all
2
costs to
minutes.
protect
Again,
my
we
daughter.
will begin in 2 minutes.
Getting the COVID-19 vaccine for me will be a huge priority. I want to do everything that I can to keep my staff healthy. It's really just the only option to resume normal life.
Walking through to the chair where the vaccine was felt like a hero walk. And I feel that everyone who is going to receive the vaccine is gonna get that feeling. You know, that split-second jab represented so much hope.
I have my sticker that says I did get my vaccination. I deal with COVID face-to-face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
When we all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
It's been really difficult lately. It's hard to teach with a mask on and not being able to project your voice. It's hard to not see the kids' expressions on their faces.
I want this needle to help me to live for a while more so I can enjoy my grandchildren and go big berries and go have fun.
I miss coming to the game. When it's time for me to get the shot, I'm gonna go sit down in the chair and close my eyes and tell them to stick me.
It's going to save not only my life, it's going to save lives of the people around me, the babies that I care for, my grandchildren, my parents. It will be so nice to not live with that fear.
I think I want to get back to being a 27-year-old, right? Back to having something to look forward to, the regular stuff.
The job is very rewarding. Every day you get a chance to help people. I got the vaccine because I would like to be protected, and at the same time, I would like to protect other people too.
For everyone who pulled together from a distance. For everyone who stayed in and stayed out.
Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe, and joining us virtually is Saskatchewan's Chief Medical Health Officer, Dr. Shahab, and the CEO of the Saskatchewan Health Authority, Scott Livingstone. Premier Moe and Dr. Shahab will have opening remarks, followed by time for questions.
Well, thank you very much. Good morning, or good afternoon, I guess it is, and thank you for joining us here today. First off, I would offer condolences to those families that have lost a loved one today and over the course of the last number of months to COVID-19. In Saskatchewan, our vaccination rollout continues to lead all other provinces in Canada. We now have nearly 40% of our adult population has received at least their first shot of the vaccine. This week, our vaccination program will expand even further, both in terms of eligibility as well as the number of locations across the province. Starting tomorrow, we are going to lower the age eligibility to 30 in the far north and 42 in the rest of the province. It's currently at 40 in the far north and 44 in the rest of the province, and then on Friday we will further lower the age eligibility across Saskatchewan from 42 down to 40. At which time, as we know, a number of additional priority groups will also become eligible for their first shot. This includes any remaining police officers that have not received their shot, as well as any remaining firefighters, frontline healthcare workers, and our corrections officers, our border crossing officers, our public health inspectors, as well as teachers and all those others that are working in our schools providing education to our children. Just a reminder for all that anyone in the province-wide age eligibility can book an appointment online or by calling our SaskVax phone line. Everyone else who is eligible needs to call the phone line to book your appointment. So this would include anyone in their 30s in the far north, for example, and anyone in these new priority groups that would become available on Friday. And of course, any eligible person can get their shot at a drive-through clinic when those are open in your area. And starting this Thursday, 63 pharmacies in 14 Saskatchewan communities will start also providing vaccinations. Most of these are booking appointments as we speak. You can find a complete list of the participating pharmacies on the government's COVID-19 website. And I want to take the opportunity to thank all of the pharmacies who are participating in this vaccine pilot, and thank in advance all the pharmacies that will be participating in the vaccine rollout in the weeks ahead. We look forward to providing vaccines to more pharmacies in more locations as vaccine deliveries to Saskatchewan pick up in early May. Starting in May, our weekly vaccine shipment from Pfizer will double, and this is a very positive thing. We will go from about 31,500 doses per week that we are receiving currently to about 63,000 doses per week, and that's going to make a huge difference. We're not sure at this point what the May delivery schedule will be from the other three companies, what that will be in the out weeks, but we expect to receive that delivery schedule soon, and we're very hopeful that those numbers will pick up as well. So today, I am also very pleased to announce one more opportunity for Saskatchewan transport drivers or Saskatchewan truckers to get vaccinated just south of the United States-Canada border. Saskatchewan has reached an agreement with North Dakota following the very generous offer from Governor Doug Burgum. And as you know, North Dakota has already begun vaccinating Manitoba truckers that are entering that province at just south of the Pembina border crossing. That was phase one. Phase two is now they are going to start vaccinating Saskatchewan truckers at that crossing as well, and that is a very busy crossing for Saskatchewan transport drivers. And in the coming days, North Dakota is going to set up one more location to vaccinate truckers as well as other essential energy workers that are crossing into Saskatchewan at the Portal or the North Portal border crossing just south of Estivale. This is great news, and I want to thank Governor Doug Burgum and the entire state of North Dakota for sharing their vaccine supply with Saskatchewan and with Canada in this manner. They most certainly understand that getting vaccinated does not protect just you, it protects your neighbor. And we are so very fortunate to have a great neighbor in the United States, and in particular, that neighbor being the state of North Dakota. Once again, I want to thank the team of healthcare staff who are delivering COVID vaccine shots at dozens of locations throughout the province, and they continue to do this, building on the last months of success. And I also want to thank every Saskatchewan resident who has taken the opportunity to get their shot. We're doing quite well in terms of uptake among the people who are eligible to this point. More than 80% of everyone over 60 and older has received a vaccine. More than 70% of everyone 50 years of age and older has also received their first shot of this vaccine. And those numbers continue to climb as each day passes. This is making a huge difference in protecting our older residents, yes, who have experienced the most severe outcomes, disproportionate outcomes really from COVID to date. At the same time as we're delivering these vaccines, it's now clear that variants that have reached Canada and Saskatchewan are resulting in more severe outcomes, and in particular among our younger population, many of who have not been vaccinated to date. We're seeing more young people in our hospitals and in our ICUs, and they are sicker, and they are remaining there for a longer period of time. So, to everyone in this province who would be under the age of 40, we are going to get you a vaccine as soon as we are able. But in the meantime, I would ask you to please be careful. You need to follow all of the public health orders and the guidelines that are in place, and that means not getting together in groups with your friends. I understand that this is difficult, and I understand how difficult this has been, in particular for those in their 20s. That's how old, for instance, my children are. And I was even that age a number of years ago. I know this is a very social time of your life, and I know you want to be with your friends. You want to go to your university classes in person, and you want to take part in all of the social activities that occur in your community. And I know what you have sacrificed over the course of this past year. But please know that it is just going to be a little while longer. And you could lose so much if you contract one of these variants, or if you pass it along to one of your friends or to a family member. So we all have 2 jobs to do over the course of the next couple of weeks, next few weeks. Whether you're 20, 30, 40, 60, 70, is to keep the public health orders front and center in what you do each and every day. When it's your turn, I ask you to get vaccinated. I want to thank again all of our dedicated healthcare workers in our vaccine clinics, in our testing centers, in the hospitals, most particularly in our ICUs, and in every other part of our health system that is functioning across this province. Thank you for what you are doing. I want to say a thank you to everyone in Saskatchewan for what each of you are doing to protect yourselves and in turn protect those around you by following the public health measures that are in place. And most importantly, I want to thank all of those that have taken the opportunity and those in advance that will take the opportunity when it's your turn. Most certainly, we are seeing Saskatchewan residents roll up their sleeves, they're sticking it to COVID, and they're getting their vaccination. Dr. Shahab?
Thank you, Premier. So I'll also start, as always, by expressing my sympathies to the family and friends of the 12 Saskatchewan residents who have lost their lives due to COVID since Thursday, and 6 deaths being reported today alone. And again, this reminds us of the devastating impact that COVID continues to have in our communities, and is a reminder that as the vaccination program expands to younger age groups, this is our most important tool to finally get out of this pandemic. And I would echo the Premier's comments that while our vaccination rates are strong, 70 and older, and that is showing in a low hospitalization and death rates, we have to ensure that as we become eligible, you remain eligible once you become eligible, and we are going to have a lot of vaccine coming over the next 6 weeks. And it is really important that we take this opportunity to get the first dose in our arms. It takes up to 3 weeks for a vaccine to start giving you protection. So, you have to give yourself 3 weeks after the first dose. And please, as we as we start second doses late in May, early June, it is also important to finish your series, because that will give you long-term protection well into the summer and fall. So I think these 2 things are something that all of us need to think about, whatever our age group over the next 6 to 8 weeks. All of us will become eligible, all of us 16 and older for the first dose, and many of us who got vaccines in March, for example, will be becoming eligible end of May, early June for second doses. And it is essential we complete our first dose and then the second dose as quickly as we are able to. I would also like to say that while this is happening, as the Premier said, it is critical we keep our case numbers low. After a lot of hard work, finally we are seeing some stability in Regina. I think a lot of the specific public health orders in place in Regina that are more stringent than the rest of Saskatchewan. Finally, we are seeing impact of that in terms of stabilization of case rates. We can't let our guard down, but we have to see a further downward trend in Regina. And the transmission patterns that are seeing in Regina and southern Saskatchewan, we are also now seeing increasingly in Saskatoon, unfortunately. It is primarily workplaces. So again, if you can work from home, do work from home. Even workplaces that have a mix of employees, many can work from home. Many resource companies have done that, that if you don't work in a mechanical capacity and can do your work from home or remotely, they have opted for that. It thins out the workplace and allows the people who have to be at work to be physically distant from each other, to be extra vigilant during break times, during carpooling, and to keep transmission rates low. And if you do have a transmission, having your cases and contact lists handy, investigating with public health the outbreak quickly gets the outbreak under control earlier rather than later. So, compliance with all public health direction, which sometimes can result in business slowdowns or closures, is going to be essential, because the quicker we do that, the quicker we can control outbreaks in workplaces. The second most common transmission, of course, is household. So again, the importance of having an isolation plan, and if you can't safely isolate at home, have a discussion with public health about what other options are available. So while we, continue to keep our case numbers down, we have to keep them down throughout Saskatchewan, including central Saskatchewan, the northwest of Saskatchewan. We are also unfortunately seeing increase in all variants, but also notably P1 variants all along our western border. So again, it is imperative we stay close to home. We minimize non-essential travel anywhere within the province or to other provinces. And if you have any concerns or have traveled, it's always a good idea, even if you're asymptomatic, if you come back to Saskatchewan, get tested on day 1 and day 10, so that if you are, for some reason asymptomatic and COVID positive, you can isolate and minimize the transmission of variants. Mask use is going to be really important over the next little while, especially in indoor public places. Again, the weather is great. Enjoy the outdoors safely, maintain your physical distance, and enjoy the outdoors. That's where transmission is less efficient, and we can safely be outdoors while we're physically distant with others not in our household. And that is going to be a mainstay in terms of how we see and greet each other over the next 6 to 8 weeks. There was some federal modeling that was released in July that suggested that, that was released last Friday, that suggested that once you have 75% uptake first dose and 20% uptake second dose, we can cautiously look at reopening as long as our case numbers are low, our hospitalizations are low. I think while that is a welcome outcome that we should all look for, I think we have to be more ambitious than 75%. And I would say all of us should consider getting vaccinated. That is the only way we will protect ourselves. And we have to remember, being young is no longer a shield against COVID. While the illness can be mild, in many cases, too many cases, it has resulted in hospitalization and death at all age groups. And so all of us should consider getting vaccinated, whatever our age, as soon as we become eligible. And there will be more than enough vaccine. That is what the shipping schedules suggest over the next 6 weeks for all of us to get our first dose, and in many cases for second doses to be started later in May, early June. Until we are fully vaccinated with 1 dose, 16 and older, and well into getting second doses, I think we really need to stay the course with all public health measures at an individual level. Obviously, we get lots of questions. What can I do now that I'm vaccinated? I think right now we need to be patient. We have seen that with 2 doses in arms, how much we can do in long-term care facilities. They can finally, after such a long time, start having visitation both in the facility, outdoors, and in their families' homes. And these are residents who are the most frail. And certainly, as more of us get vaccinated, we can all look to gradual relaxation of public health measures. But before we get there, we have to have 1 dose in arms, all of us, 16 and older, and then very quickly, as soon as we become eligible, second dose in arms. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll take questions now, and we'll start in the room. Lynn?
With seeing several more P1 cases pop up in multiple regions of the province, are we kind of expecting there's just community transmission of the P1 now, and what does that change for Saskatchewan?
I would just very quickly, and then Dr. Shahab and maybe even Scott would have some comments on, you know, where the P1 is and in what concentrations. But P1 is transmitting in Alberta, and we share a border with Alberta, and so it is starting to show up on our west side, which I think would be, you know, somewhat expected over time, as we've seen the UK variant, for example, moving not specifically outside of Regina to the rest of the province, but we had a higher concentration in Regina, and we said as the more transmissible variants, you know, they eventually will make their way across the province. So I think what is the only positive piece I would say with respect to the variable number of variants that we're dealing with is that to date it seems like the vaccines are effective on the ones that we are dealing with here at this point in time. And so the message is very much the same, maybe even stronger, around following the public health orders that are in place and ensuring that when it's your opportunity to get vaccinated. Dr. Shahab or Scott, do you have anything to add to that?
Yeah, no, I would just say that, you know, we've come a long way, you know, together, and this is not the time to let our guard down, and especially as it relates to interprovincial travel and non-essential travel. We really need to be careful not to travel unless essential. Even if we do have to travel, you know, observe all public health precautions in the jurisdiction we find ourselves, and we absolutely need to keep all COVID cases low, and especially variants of concern.
Follow-up?
Yeah, yesterday, Regina Public and Catholic School Divisions said that they're going back to in-person classes starting May 3rd on the advice of Regina medical health officers. Why are schools being told that they can reopen when, like Dr. Shahab said, like we're still seeing a lot of variants and Regina's cases aren't dropping that much?
Dr. Shahab, do you have any comments on the advice that was provided from public health to the Regina school divisions?
So schools in general have done extremely well ever since September, and we have repeatedly analyzed cases in the community and cases in schools, and schools are not the hub of transmission. You know, some workplaces have been, but schools show cases for the most part that are imported because of high transmission in the surrounding community. And on the advice of Regina medical health officers, Regina Public Health Division, Regina School Divisions, public and separate, went to level 4. But now that cases in Regina are settling down, are coming down, it is their advice, both public health and the school divisions, that schools can safely reopen. And of course, schools have a very well-established system where there's all these layers of protection, you know, cohorting of classrooms, level 3 if required for large high schools, appropriate mask use, including medical masks and face shields where appropriate for staff and teachers. So all those measures have kept schools very safe places to learn in person, which is the best way to learn. And of course, when required, you know, schools have no hesitation working with public health going to level 4. But right now, you know, it is the advice of public health, and school divisions agree that Regina can safely start in-class learning. But, you know, these things are assessed on a day-to-day basis by all school divisions with local public health, and adjustments made as required.
We'll take another question in the room. Mark?
Yes, Dr. Shahab had mentioned case levels starting to level off in Regina since the stricter measures have been put in place, but test positivity has risen over the past 3 weeks, and testing numbers are going down in correlation with that case number drop. Have we seen the impact that we wanted up from these measures, or does more need to be done?
Dr. Shahab, I'm just maybe a quick statement on Regina, and I won't get into the epidemiology of the testing numbers, and there's testing capacity that is available for those that choose to be tested, and we encourage those, you know, if you have any concerns at all that you've been in contact or any symptoms for certain, to get out and get tested. We most certainly do have the capacity to test you and to provide you with those results as often as is ultimately necessary. The vaccine availability in Regina on a per capita basis has been as large as anywhere in Saskatchewan, save for possibly the far north, where we have a lot less people. But we have intentionally channeled vaccines into the community of Regina due to the high variance of concern that arose here a number of weeks ago, and made many of those vaccines available through our appointment-based system, through the drive-thrus, and ultimately now coming this week through pharmacies. We're now doing the same in Saskatoon to ensure that we are keeping up with our vaccination rates to the level that we can, and with respect to the vaccines that we are receiving in Saskatoon as well. So, ultimately our path through this is vaccines. However, in saying that, there are significant measures in place across the province, more so in Regina at the current moment, to deal with the variants that we've been challenged with here, the concentration of the variants that we've been challenged with here in Regina. Doctor, anything to add to that?
Yeah, I'll just give some specific numbers for Regina from today. So Regina, after many weeks, is under 30 cases per 100,000. It's at 27 cases per 100,000. So definite downward trend. But again, we can't celebrate yet. We have to stay the course. Test positivity after many weeks, over 10% is now just under 10%. But again, we have to stay the course. I have to say that this is the first time over the pandemic for the last 14 months, this is the first time that throughout Saskatchewan and all geographical areas, except maybe far north, central and far northeast, throughout we have seen testing above the recommended levels. And that is going to be critical over the next few months. Even as we get vaccinated, test and trace is going to be an essential layer to make sure that if there are pockets of COVID re-emerging, we can quickly isolate, screen them for if there are variants of concern or new variants, and keep COVID at bay even as we get vaccinated and remain vaccinated. So testing is a mainstay. We have been doing record number of testing throughout Saskatchewan, and our overall test positivity is 7.4%. So generally, and even in Saskatoon, test positive is 5%. So generally, the trends are looking stable or improving. But I do want to say that because of the increased case numbers in Saskatoon, and because 60% of them are variants of concern, primarily B117, and because we have now found P1 in Saskatoon as well, we need to remain extremely vigilant for the next 6 weeks as our vaccination program allows everyone 16 and older to get the first dose. Thank you.
Follow up, Mark?
With the P1 variant now being detected in more regions along the Alberta border, has there been any consideration of restricting travel to and from Alberta?
Dr. Shahab, a quick comment, and you may have more to add. The strong recommendation around not traveling in and out of the province has been there for some period of time, and that would remain today. There are people that we know do have to travel back and forth across the border for work, for essential reasons. Likely are people that have traveled for non-essential reasons as well, but there are people that are crossing that border, often for essential reasons, and that is the way that it is, along the western and even the eastern side of our border. But that strong recommendation remains today. Dr. Shahab, anything to add to that?
Yeah, I mean, all I'll add is obviously there's many local travel that occurs across provincial borders and local communities, for work or school, and that certainly, should continue. But obviously everyone should observe all the public health recommendations. All of Western Canada has significant restrictions now in place that are very similar: Manitoba, Alberta, Saskatchewan. So, but of course, even if we are to travel, we have to be extra vigilant. We know what's happening in our home communities, but if we have to travel for essential services, we need to be extra vigilant and be extra cautious. Mask use all the time in indoor public spaces, frequent hand hygiene, get tested on coming back. I think all those things are essential. But like the Premier said, throughout Western Canada, because of especially local interprovincial travel in border communities, it's a strong recommendation not to travel for non-essential reasons, while of course that doesn't impact the border communities. And of course, I can't stress this enough, If we have 70% vaccination rate in 60 plus, for example, why are the 30% who still haven't gotten vaccinated not getting vaccinated? And that applies to every successive age group. As the vaccination rate picks up, if you are not in that number of percentage vaccinated, I think you have to ask yourself and have a discussion with your friends and family. We need to encourage all of us to get vaccinated. If you have any concerns, we have excellent information on our website. Talk to your healthcare provider, talk to public health, talk to your pharmacist. There's lots of information to answer any questions you have about vaccination. And, I would say all of us should look at getting vaccinated for the next 6 to 8 weeks. Thank you.
We'll take our next question on the line. Operator?
We have Lisa Schick with CJME.
Hi. With 14 more cases of the P1 variant identified, are these related to the original 5 in the Southwest? And how concerning is it that you're seeing more of this variant, which I understand is particularly transmissible?
Dr. Shahab?
All linked to the initial cluster. But again, like the Premier said, if you look at the P1 variants, they have been identified throughout Canada, especially in BC, Alberta, now Saskatchewan, Ontario, Quebec. And I have to say that, the fact that we are identifying variants of concern is due to the excellent processes we have and the excellent, physicians and staff we have in the lab system in the SHA. Because I think we have world-class capacity to screen all COVID cases through SNP testing for variants of concern, and then send additional, SNP positive for whole genome sequencing. So it's good that we're identifying them. Many parts of the world have nowhere the capacity that Saskatchewan has to screen all tests, 100% screening. I think few jurisdictions in the world have this capacity. So it's good that we identified them, and that lets us be extra cautious, extra informed. And yes, it's true that the reason these are called variants of concern is exactly the reason you mentioned, that they are more transmissible. We are trying to establish if they're more severe. Certainly, the increase in hospitalizations in young people with B117 suggests that it can have a more severe outcome in young people. We are still, investigating is P1 also more severe, but athletes in BC had P1 and were quite unwell with that. So it's not a trivial illness in young people, COVID. It can sometimes be severe. And we recently in the media heard about elite athletes become seriously ill with COVID. And certainly what's even more concerning is that how effective is the vaccine? Now, thankfully, with B117, the vaccine seems to work very well, but we are waiting further information about how effective the vaccines are against P1.
Follow up, Lisa?
Yes, in today's news release, there's mention of reporting of adverse events from vaccinations. Just wondering why, I guess, picking that out in particular today. Have people been calling maybe a wrong number about that? Are we getting a lot of reports about adverse reactions?
I think certainly vaccines, like any therapeutic product, are approved after review of the safety and effectiveness. Vaccines remain the most effective therapeutic intervention, but obviously there's been some concern about vaccine-induced thrombotic events following AstraZeneca. So we always investigate all adverse reactions, following vaccinations up to 28 days. And we have seen what we expected to see. We have seen allergic reactions, very rare anaphylactic reactions that are managed on site with no long-term effects. We have not to date seen any thrombotic events, and we have to remember that we have had several thrombotic events that happen that are not uncommon sometimes post-op or after certain procedures, and that's why sometimes special provisions are done post-op to prevent thrombotic events. But when they happen, they are investigated, and in this case, because 400,000 people have gotten vaccinated in the last 3 months, it was it's always the case that rarely you would have someone who got a vaccine, any vaccine, over the last 4 weeks and developed a thrombotic event, usually following a surgical procedure or other procedures. So they're always investigated along with specialized testing and consultation with excellent hematologists that we have in Saskatchewan to see if there's any relation to vaccines. And so far, we have not identified any link to vaccinations. And of course, if we were to see any thrombotic event linked to any vaccine, including AstraZeneca, we would publicly report that. But again, I think the reason for mentioning that is that on the one hand, we know vaccines are extremely safe, serious events are rare, and they prevent COVID infection, which can have severe outcomes both in the immediate term, including thrombotic events. 15% of all people who develop COVID illness can have thrombotic events, as well as, unfortunately, as we have seen, hospitalization and death, and can in some cases have long-term effects. So we want to ensure that we are transparent about vaccines and their rare adverse events. And we are transparent about all vaccines, whether it's the flu vaccine, any other vaccine. They remain extremely safe, but we routinely report both provincially and nationally any adverse events related to vaccination.
We'll take another question on the line. Operator?
We have Kelly Malone with the Canadian Press.
Hi, Kelly Malone with the Canadian Press. So Saskatchewan is seeing a younger population hospitalized in the ICU, and unfortunately, we've seen over the last few days more deadly outcomes. Are you going to continue a largely age-based approach, or are you looking at what, say, Manitoba and Ontario are doing with prioritizing neighborhoods with higher rates of spread?
As I said in our opening comments, what we're doing tomorrow is we are reducing our age-based approach to 42. This Friday, we'll be reducing it to 40, which will then trigger a number of other categories that will be able to make appointments or to find their way to a drive-through appointments at a pharmacy or through the SHA system. That includes any remaining police officers, firefighters, any correctional officers, our teachers, our education staff. There's a number that we have in our news release that will be included once we achieve the 40 age bracket. The reason we have moved through the age-based criteria down to 40 is just simply that, and I've said these stats here before, I believe it's 84% of our hospitalizations to date have in people above the age of 40, 96% of our fatalities. As we are moving down below 40, we're going to continue on with our age-based reducing our age-based criteria, our eligibility, until we get down to 18. I believe it might be 16 for Pfizer. And we're going to try to get there as soon as possible so that everyone will have access to get a vaccine in the weeks ahead. As we heard earlier, Dr. Shahab had said we're going to have what we feel will be much larger deliveries of vaccines from the federal government over the course of the next number of weeks. And it's our intent to make them available to all Saskatchewan residents as quickly as possible.
Follow up, Kelly?
Dr. Shahab, do you have anything to add to that?
Yeah, I'll just say that, many of us have busy lives. You're working, you've got families, but don't put off vaccine. You can go and get vaccinated during work time. I think it's like voting, that you can get vaccinated anytime that you're eligible, and do find the time, because while it's great that we have high uptake, but I think I'm very concerned about the 20-30% who are choosing not to get vaccinated as soon as they're eligible. I think all of us should find the time to get vaccinated for ourselves, our families, and children under 16 can't get vaccinated. The quicker parents are vaccinated, school staff are vaccinated, the more dramatic decrease we'll see, even in for example, children coming to school who ultimately are COVID positive. So I think all of us need to have a plan that as soon as we become eligible, how will we get vaccinated? And I've said this in the past that we should challenge the Saskatchewan Health Authority to make them run out of vaccine before the next shipment comes.
I just add quickly, Kelly, and sorry I failed to mention in my first answer. We've also taken an allocation from the provincial allocation and provided a number of vaccines to Indigenous Services Canada to distribute among our Indigenous communities in the province. I represent a number of them, and I do know that there are vaccines that are being made available in Indigenous communities across this province as well, and that's through a provincial allocation to those communities. And those communities are doing an excellent job in providing those vaccines to the residents that live in their communities, and my hats off and my appreciation to them as well. In addition to increasing the opportunity, the eligibility, the convenience, if you can, of getting a vaccine, Saskatchewan was the very first province to move on allowing a 3-hour paid break to get your vaccine here in this province, to encourage everyone wherever they work to take that time to get vaccinated. Ultimately, the higher that we're able to push these vaccination levels over the course of the next number of weeks is really going to determine, yes, the time that we're able to maybe start getting back to normal in our communities, but just as importantly, and probably more importantly, we'll start to substantially lower our hospitalizations and our ICU entries. That is what that has occurred in other areas of the world that are ahead of us in their vaccination rate, and we seek that here.
Follow up, Kelly?
I know that this was touched on previously, but we're seeing provinces bringing in tighter restrictions from coast to coast to weather this third wave until vaccine capacity gets higher. Those 6 weeks that Dr. Shahab was talking about before Pfizer really starts flowing into the country. Manitoba is banning private gatherings. BC has brought in significant travel restrictions to your health region, and Ontario is more or less in full lockdown and closing its borders. So is Saskatchewan looking at any additional measures in these 6 weeks before vaccine capacity gets to the point that you want it to be at?
So I would say right now, just very quickly, and Dr. Shahab, you can speak to any measures. But with respect to vaccinations, Saskatchewan is leading the country in the vaccine rollout that we have, and the Pfizer vaccines that we are receiving are going to double next week. Not in 6 weeks, but they will be doubling next week, and we'll be making those available to Saskatchewan residents through pharmacies, through our SHA appointment system, as well as drive-thrus if we're able to have vaccines available for that as well. So Saskatchewan's vaccination plan has been on full steam ahead. Admittedly, in the early days, we had a sluggish start, but most certainly the Saskatchewan Health Authority and all of those involved have risen to what is likely one of the larger challenges that we have been presented with in decades, and my appreciation to each and every one of them. So, but our vaccine plan, as I said, the Pfizer doses will be doubling next week. We're waiting, and hopefully we'll hear on the other 3 vaccines shortly, but we are expecting that we will get delivery shipments on some of the other 3 types of vaccines, Moderna, AstraZeneca, and Janssen, in the days ahead, the delivery schedule, and then in the weeks ahead, actual delivery of those vaccines as well. So we feel quite confident that our vaccine increase is going to happen sooner rather than later. Dr. Shahab, anything specifically on the measures as vaccines arrive in larger numbers?
Yeah, regarding public health measures, we have to recognize that we have quite strict measures province-wide, including the inability to meet indoors in any sort of household bubble, with some exceptions for single persons. And that is quite significant. And the reason, and it's a hard measure. It's so hard not to meet anyone in your house. We did allow for bubbles of up to 3 households in other places except Regina for a while, but now, for several weeks now, we have been at no households can interact with any other households. This is the most significant measure that impacts all of us. And many provinces have only now enacted this measure because we know that up to half of transmission happens in indoor private places, notably our homes, when we meet and greet each other. So that's a very significant measure. Secondly, obviously gathering limits are capped both indoors and outdoors. Having said that, being outdoors on your own or with if you are with someone not in your household, maintaining that 2-meter distance while you're out is a safe way to be physically active and be social while being outdoors but not indoors. But if there's any further specific measures, they will obviously be looked at very closely. And again, apart from household transmission, a lot of the transmission happens in workplaces. So again, the recommendation province-wide right now is where you can work from home. And I know many employers have supported employees to work from home where that's possible. Sometimes it's hard to work from home. So we miss the collegiality of our colleagues at work, but I think we need to for the next 6 weeks, continue to work from home. And then where you have to be at a workplace, because it's the kind of work which you can't do remotely, working in a way that you are physically distant from other staff. You work in a cohort so that if you, for some reason, are COVID positive, only a limited number of people are exposed who may then have to isolate at home. Many employers have developed excellent COVID protocols that they have further tightened due to the variants of concern. And then again, working closely with public health. If there's an outbreak, sometimes business operations may have to slow or cease for a while. It's disruptive, it's costly, but the quicker an outbreak is investigated and handled, the quicker business operations can resume. So again, working closely with public health, that's happened in Regina, it's happening in Saskatoon, and throughout the province where required. But I think these are going to be the mainstay. And then I would again say that, there are people in age groups that have become eligible, 50 and older, 44 and older, remain unvaccinated, who continue to work in essential workplaces. So whatever kind of work you do, I think as soon as you become eligible, please do get vaccinated.
We'll take our next question in the room. Adam?
Dr. Shahab, you said that being young is no longer a shield against COVID. We know that the variants are more transmissible, and you said that schools have been good at protecting people against transmitting COVID. There are probably parents, teachers, students watching in Regina. They know that the recommendation has gone for schools to reopen next week. What is the variant? How does the variant play into this recommendation? And is there a heightened concern because we didn't see the variants earlier on in the pandemic, and now they're here, and we have schools reopening?
Yeah, so I think we need to recognize that not just since September, but even over the last 2 months, as variants of concern, especially B117, has shown up in Regina, in southern Saskatchewan, and now slowly making its way north. Schools have remained open to in-person learning. Where required, like in Regina, they have gone to level 4. And that's mostly been due to disruptions, because with variants of concern, sometimes if you have a student who's positive, the whole class goes online. And then if you have high community transmission in a school with 12 classes, you may have 3 classes going online or level 4. And then due to that, it's sometimes more efficient for the entire school or school division to go online for a period of 4 weeks. It's less disruptive. But in-person learning is optimum, and many schools throughout Saskatchewan, including Regina, have successfully continued in-person learning even with variants of concern. But again, it's a dynamic situation, and where required, schools go to remote learning and then come back to in-person.
Follow up, Adam?
The question about Saskatoon, you said that Saskatoon cases are rising. This is for the Premier and Dr. Shahab. What's the concern level of what we're seeing in Saskatoon? I know we're diverting vaccines there a little bit. What would it take for us to put measures in place that we see in Regina in Saskatoon, as you've said, to protect the healthcare capacity? First to the Premier.
Well, yeah, first of all, that is why all of the measures that we've put in place are there to, one, protect lives, but two, also to protect our healthcare capacity here in the province, and our understanding that it's a provincial healthcare capacity. So, at this point, we haven't had conversations around, what benchmarks would we look at with respect to adding further measures into the city of Saskatoon. We have had discussions around, are we ensuring that we're going to have enough vaccines to move those 2 large centers, Saskatoon and Regina, down at the same rate as the rest of the province, and how accessible are those vaccines? And part of engaging our pharmaceutical capacity this week and into the weeks ahead is about expanding that access into A, those larger centers, but B, ultimately across the province as well. So I trust and I know that Dr. Shahab and his team, and I think in fairness everyone, is watching the variants of concern levels, not only in Saskatoon but in other areas. We continue to watch them down throughout the southeast and the south central areas as well, Moose Jaw down through Estevan and Weyburn, where to date they've seemed to be on a similar trajectory to Regina, where maybe they have plateaued, hopefully, but at a level that is somewhat higher than I think what anyone would like to see it. So, Dr. Shahab, on variants of concern levels in Saskatoon and ultimately restrictions, conversations that may come about due to those.
And so, as we expected, we were able to, through, most likely people avoiding non-essential travel from Regina to Saskatoon, for example, and there was evidence from the Department of Highways that traffic volume did decrease by 10 to 15%, and Google mobility data also showed that. But we have to, we knew that over time, B117 will make its way out of Regina to the south, which it did. We saw increased transmission primarily in larger urban centers in the south, but throughout the south, Moose Jaw, Weyburn, Estevan. We also know from other jurisdictions that the larger the urban center, the harder it is to control surges. You have to sometimes put in, more stricter measures, which did come into place in Regina. But at the end of the day, despite all those measures, it is our individual actions at home, at work, that make the difference. And that's why, Saskatoon, we have to watch very closely, work very closely with public health in Saskatoon, because we absolutely don't want to see the surge that we saw in Regina happen in Saskatoon, and take whatever preemptive, specific, or more broader measures that are required. But at the same time, make sure that the pace of vaccination remains high, because I think that has to happen at any cost as well, while other measures may or may not be required. So at this point, Saskatoon remains on the cusp. Case numbers remain in that 50 per day, 70 today, which is very concerning. The proportion rates of concern is trending up from less than 10% a few weeks ago to 30, 40% a couple of weeks ago to 70% of all isolated surveillance of concern, mostly B117 and occasional P1 now. So I think Saskatoon is on a red alert status, and if required, specific measures may be needed. But at the end of the day, it is our individual actions, and especially care when we're out and about. Minimize unnecessary visits to public indoor places. Order more takeout. Use curbside pickup whenever you can. By all means, support your local business, but use all these tools that business have allowed us to use, and be extra vigilant at work. Work from home when you can, and really refresh your COVID protocols. Make them twice as tight as they were before. I think all those measures starting today will be critical for Saskatoon.
We'll take our next question in the room. Murray?
I'd like to follow up on Adam's comment on benchmarks, and just to ask you if you think the current numbers benchmarks are suggesting success, because Dr. Shahab used to tell us that 200 cases a day was highly problematic, and it obviously is given what we're going through. We've got more variants, and we've got vaccines right now that should be lessening cases, yet we haven't been below 200 cases a day on the 7-day average all of April, and that's pretty consistent where we were in February. So, Mr. Premier, I guess I'd like to know, do you consider what we've gone through in this month to be a success? Because the numbers given to us in the past as benchmarks kind of suggest that we're not. That this wouldn't be what you would have said in the past was a successful run.
Yeah, I don't know if I would say it's a success. I think a success would be, to Dr. Shahab's comments, that would be everyone in the province being vaccinated would ultimately be a success. Do I think this month has been a strong month for Saskatchewan? No, I most certainly would like to see the numbers lower. But when you look at what is occurring in other areas of Canada and other areas of the world, I said earlier today, from early April until about the 25th of April, we saw the cases worldwide go from about 450,000 a day to about 850,000 a day. Not quite a doubling, but virtually a doubling. Three countries have seen their cases go down: Israel, the UK, and the United States. All three countries that have very, very high vaccination rates relative to the rest of the world. They range from 40 to 60%. Saskatchewan is running a little bit above 31%, maybe 32% in our vaccination rate of the entire population, close to 40% of those that are eligible. So we're behind those jurisdictions, but not very far behind. And we're hopeful that those vaccination rates, as we achieve the same metrics as those countries, will most certainly, improve our hospitalizations, our severe outcomes here in this province, which is why we are stressing again today the importance. Dr. Shahab and myself, I think both of us made comments around the public health measures that are in place now. It's so very important, probably as important as it has ever been throughout this pandemic, for the reasons that you mentioned, Murray. The introduction of variants. We do have a high caseload in a number of communities in the province. It's so very important for us right now to ensure that we are going above and beyond with respect to what we are doing, how we are conducting our own actions each and every day. And just as important as that, and the second job that we have to do is, when it is your turn, go out and get vaccinated.
I want to go back to the benchmarks again, because the public keeps asking, what is the government looking for in terms of changing things, either going up or down? And obviously, the concern in Saskatoon might be further restrictions. Yeah. But if we're thinking about lessening restrictions at some point, and I'm sure that's crossed your mind, where do we have to be? Is it 100 cases a day? Is it 50% of the population vaccinated? Is it a positivity rate of around 5%, which would be half the current 10% in Regina? What is it that you are looking at before you make the next major change? And can you be specific as best you possibly can in terms of what the public needs to look forward to as their goal to help you in reopening the province?
Sure. Dr. Shahab is, with respect to any metrics on measures, Dr. Shahab, I'd ask you to comment on that, and then I'll have a couple comments on a couple other metrics that I watch closely with respect to what the people of the province can look to as to ultimately finding a path through this pandemic once and what will hopefully be for all.
Yeah, thanks, Premier. So, I think we have had to calibrate all assumptions, recalibrate all assumptions because of variants of concern. So, on the one hand, more transmissible, but at the same time, we have to recognize that we have another very effective tool, that is vaccinations. And as the Premier mentioned, 3 countries have shown. So, UK and Israel actually in January were in their third wave at 1,000 cases per million, which for us would have been 1,000 cases a day when they began the vaccination program. Israel, a 2-dose program, UK, 1 dose, followed by now 2nd doses. In both countries, hospitalizations have gone down, deaths have gone down, new cases have gone down substantially. They still are the UK is doing very high rates of testing, so that even though cases have gone down, they don't want to miss anything. So maintaining high rates of testing are critical. So it's not just number of cases, it's what's your test positive. You're absolutely right. We want to have high testing rates and low case rates. And we have to remember, the more you test, the more you find, and that's a good thing. And the more you screen all COVID cases for variants of concern, the more variants of concern you find, which again is a good thing. So, I think we should welcome the fact that we find all these variants of concern through 100% universal screening that very few jurisdictions can do. So given that, I absolutely agree we need to see low new hospitalizations in acute care and ICU. And unfortunately, as Mr. Livingston can confirm, young people stay for a long period of time in hospital and ICU and in acute care. But we have to see absolutely reduction in new hospitalizations. We need to understand who is getting hospitalized, age range, exposures. And, because most hospitalizations, serious outcomes are in unvaccinated, as we go forward, we'll have to keep understanding if we see hospitalizations in people who were eligible for vaccinations and why people are still choosing not to get vaccinated. We absolutely need to understand that. And that brings me to my third point, that while the federal government has set a target of 75% 1 dose and then 20% higher 2nd dose, as in the presence of low case numbers and low hospitalizations, we can cautiously look at reopening. I would challenge all of us to go for a higher vaccination rate, because that is absolutely essential. Vaccines are safe and effective, and they will have to be a key, tool for us to come out. And if we look at 70% vaccination rate, for example, if the 30% who choose to be unvaccinated are also those who are working outside the home, more social, we will continue to see high rates of transmission. So we have to understand why transmission is happening, why people are choosing not to get vaccinated, address vaccine hesitancy as individuals, talk to your public health nurse or talk to your healthcare provider, talk to your pharmacist. And at a family level, we all should be having discussions. If you're eligible, why did you not get vaccinated? If you're not eligible, what's your plan to get vaccinated as soon as you get eligible? Vaccines are not mandatory, but they are essential. And unless we have a high vaccine uptake, that will be a key new metric in addition to all the other things I mentioned. But, I'll just go with the other things, maintaining a high testing rate, and then in the presence of a high testing rate, seeing low case numbers and low test positivity, and of course, a reduction in new hospitalizations to ICU and acute care. Thank you.
Scott, do you want to? One of the metrics that I'm going to mention is hospitalizations, and just before I do, Scott, do you want to maybe just talk a little bit about hospitalizations? You were through the ICU in Regina here last week, and what you see changing with respect to the admissions, length of stay, those types of things.
Sure, thanks, Premier. I guess I would start by saying, and I think folks have heard me say this before, that this is not the same COVID virus that we were dealing with in 2020, and certainly what's happening in our hospitals, not just in Regina, but across the province, is concerning when it comes to the variant of concern. We're seeing younger people coming into the facility. They're sicker, and often the results are tragic. And it's putting a significant pressure on the system as we work through our response. We've got a lot of tired critical care folks here in Regina that are ensuring that our patients are as safe as possible. And despite their heroic efforts, we're seeing some of the most tragic outcomes. So even though our hospitalization rate has averaged lower, we are seeing more hospitalizations in the first 3 months of this year than we did all of 2020. And again, it's those younger individuals. And I know we've talked a lot about vaccine today, but that's another important thing to mention is many of these individuals that are hospitalized with this most aggressive variants of a concern are not immunized at this point in time because they're not old enough or they actually meet the criteria for age vaccination while they're in hospital with COVID, so they're not being vaccinated. So it's, that together with our combined efforts on public health orders and other things are just so important right now as we move through this next phase of the pandemic. To try to support those teams across the province dealing with hospitalized patients throughout this third wave.
And so I maybe just a couple of comments that I would make on the metrics that I watch, Murray, and the metrics ultimately that we'll measure as we move through ultimately what will be our exit from this pandemic. First of all is fatalities. Most certainly, we all have our eye on the most severe outcome of COVID. And with respect to COVID, we have about 40,000 cases now in the province we've had over the course of the past year, and we've had 482 fatalities. And so that is a metric that everyone is watching. The most severe outcome of COVID. The next most severe outcome of COVID would be ultimately hospitalizations and those in our ICU departments. And we've said many times that we will continue to make decisions to ensure that we can preserve the capacity of our healthcare departments. And we've made there's been decisions made by Scott and his team with respect to how we are utilizing the capacity, the provincial capacity of that healthcare system, in particular our ICU system, to support the higher levels that we have had in Regina due to the higher concentration of variants of concern. Ultimately, what drives both of those metrics is our vaccination rate, and that is showing up. And I use the UK and Israel and even the United States as an example of how when you have higher vaccination rates, ultimately that does drive down your hospitalizations and most certainly does drive down your fatalities. Which would bring me to my last point with respect to what measures can Saskatchewan people look to improving for us to find our way out of this. And Dr. Shahab has mentioned it many times today, go get vaccinated. everyone should be considering going and getting vaccinated. If you want to find your way through this pandemic, we won't be able to find our way through this pandemic if our ICU departments, if our hospitals continue to be filled with people, and Scott had said it, that ultimately weren't able to or chose not to be vaccinated. And in the weeks ahead, we will have our vaccination program eligibility opened up to everyone in the province, and we would encourage everyone to take the opportunity to go get vaccinated. We have made every effort to make it as convenient as possible for you to do so, and by doing so, it will ultimately lower our fatalities, it's going to lower our hospitalizations, and it's going to allow us to have a very positive conversation on where and how this province is going to exit COVID. There are a number of numbers specifically that we are looking towards. We are approaching this Friday. We'll make vaccines eligible to those 40 and over. We're currently at 71% of those 50 and over have received their vaccine. Dr. Shahab said he wonders where the other 30% are, and I do as well, and we would hope that as they continue to be eligible, they will get their vaccine. But as we get to 40 and over and we start to achieve those metrics of 70% of those folks vaccinated, that is going to drive our hospitalizations down over the course of time. Pardon me?
Scotia today is a benchmark. Do you think what they did today, calling in...
Who did today?
Nova Scotia, calling
Okay.
in the troops and such. Do you think that was...
What did they do today?
Well, basically, in essence, they asked for help, as Ontario did. In terms, I guess what I'm trying to get, once again, sorry to interrupt, but the benchmark figure, what would it take, what would the similar situation in Saskatchewan be before you would have to consider asking for outside help, as Premier Ford did, as they are in Nova Scotia? I take it you don't think we're anywhere near that in terms of
no, to date, we have the provincial capacity, which I mentioned earlier, that are we have been looking at how we allocate that provincial capacity, whether it be human resources or actually moving patients into other areas of the province where we have that. For instance, our challenge has been ICU capacity in the community of Regina. But ultimately what's driving that, whether you're in Nova Scotia or in Saskatchewan, is your vaccination rate. And that is the metric that we are watching. That is the metric that's going to determine the other rates, the rates of more severe outcomes of COVID. So I would just say this: if you have not considered getting vaccinated and you're eligible today, I ask you to consider. That is our way through this pandemic. As your age or demographic comes due for a vaccination or becomes eligible for a vaccination, please roll up your sleeve. This is our path through it. If we're able to achieve much higher vaccination rates than even Dr. Shahab had mentioned, or able to achieve 70% of our population being vaccinated, I think we're going to see a very different outcomes in the months ahead. So that is our jobs as Saskatchewan residents: is 1, follow the public health orders; 2, when it's your turn, get vaccinated.
We'll take our final question on the line. Operator?
We have Ryan Kessler with Global.
Good afternoon. My question is regarding the Johnson & Johnson vaccine. 300,000 doses, we're told, are expected to arrive in Canada around the end of this week. Any idea how much of that Saskatchewan can expect?
Scott or Dr. Shahab, if I haven't seen the delivery schedule for J&J. However, it has been indicated we would be receiving some. Normally what we receive is about, on 300,000, we would be 9,000 to 10,000 doses, if my math is correct.
Yeah, we usually get about, proportionate to our population, 18 and older, about 8%, so 8,000 or something. And again, to date, and Scott can confirm, we can vaccinate as many vaccines as we receive. All 4 vaccines are safe and effective, and we will take whichever vaccine comes to Saskatchewan. They're all approved for use. 18 and older, AstraZeneca currently, we have used for 40 and older. Many provinces are currently vaccinating 30 and older. We will as well if we get AstraZeneca. Johnson & Johnson is approved for 18 and older. In the US, they reviewed Johnson & Johnson again, and it's available in the US, 18 and older. It's a single-dose vaccine. Health Canada has approved it for use 18 and older in Canada. So, any vaccine that comes to Saskatchewan is a safe and effective vaccine, and the bulk of the vaccinations for the next 2 months are going to be Pfizer, and then increasingly Moderna is finally coming in increasing volumes. We may get some AstraZeneca, which has uh, done remarkably well in Regina in terms of quickly boosting the vaccination status of 58 and older in Regina, including myself. I chose to get AstraZeneca when my turn came. And so any vaccine that we get, we can quickly use as appropriate. And certainly the advantage of Johnson & Johnson and AstraZeneca are that both of these vaccines are fridge stable, so you can transport them in a much more easier way. And Johnson & Johnson is one dose. So again, it may be especially useful for people who are moving around and would prefer to receive one dose. Thank you.
Do you have a follow-up, Ryan?
I do, and I know the best vaccine is the first one that's available to you, but as mentioned, this is a unique vaccine because of the fact it's not ultra cold, it is a single shot. What is Saskatchewan planning in terms of how that shot will be administered, in terms of the population, the geography, that type of thing?
Scott, maybe I'd ask you you might want to address the earlier question as well around the delivery schedules. As of this morning, I hadn't seen anything, but you might have had conversations as the day progressed. I'm not sure.
So the numbers that both Dr. Shahab and the Premier have quoted for Johnson & Johnson are what we believe we're getting. We haven't got confirmation of the Johnson & Johnson delivery, but it'll be around that 9,000. The other thing I would confirm just before I answer your question about what we're considering or the patient population for the Johnson & Johnson vaccine is Saskatchewan has, since the beginning of our vaccination program, and in particularly since March, has always had more capacity than we've had vaccine. With pharmacies coming online this week, we'll gain a tremendous amount of significant capacity across this province. And I don't believe, although I think there is good news on the horizon with more vaccine coming, both in May and in June, particularly Pfizer vaccine, we will not receive vaccine on a weekly basis that will ever test our true capacity to deliver it. And as Premier has said, and Dr. Shahab has said, if we had all the vaccine we needed back in January, we'd be in a much different situation. And so would everyone else in this country, given the capacity that has been built across healthcare systems to deliver vaccine. With respect to the decision on who Johnson & Johnson will be used in, Dr. Shahab touched on some of the considerations by the clinical advisory group and some of the folks within SHA on where we might want to target. One of the things that will be considered is the small number of doses. If we're only getting 9,000 doses initially, likely we'll be targeting some of those harder to reach groups, individuals that might be transient, a little harder to get that second dose. But that's right now where the initial consideration is going, but I don't know if Dr. Shahab has anything to add to that.
Yeah, one thing I would say, and I would like to recognize Scott and the SHA and Indigenous Services Canada, that the hallmark of Saskatchewan has been not only the capacity to deliver as many vaccines as we receive, but to be very nimble and flexible. So if there's been sudden disruptions in supply, so instead of Moderna, Pfizer has gone ahead. Moderna, which is -20 frozen state, has gone to all four corners of Saskatchewan, even the far north. So at that time in January, there was no fridge stable vaccine. So Moderna was going in the far north, transported safely and given to remote communities in the far north. And again, we have to. It is critical that all people in Saskatchewan, including the far north, we achieve high vaccination uptake. And similarly, while all vaccines are safe and effective, and AstraZeneca and Johnson offer some advantages because they are fridge stable, and Johnson & Johnson's one dose. Certainly, we will not wait for those vaccines. We will give whatever vaccine comes to any age group and in any geography and any situation. I think the folks who are involved in the behind the scenes, obviously the vaccinators, physicians, nurses, pharmacists have been front and center. But the folks who are the unsung heroes of the vaccination program, the logistics people working behind the scenes, safely transporting vaccines on their required cold chain, -70, -20, -70 for Pfizer, -20 for Moderna, 2 to 8 degrees for AstraZeneca and Johnson. they have been able to distribute any vaccine anywhere. And so the vaccine program is not beholden to one product or to any disruptions in shipping schedules. It is surging ahead and is able to pivot. AstraZeneca, there were different plans initially, but with the surge in Regina, all the initial doses, 15,500, pivoted to Regina and saved lives. So again, I think that is the hallmark, both the capacity and the nimbleness, and that is going to be critical in the weeks ahead.
I would just add to Dr. Shahab's comments with respect to the very strong response from the Saskatchewan Health Authority and just as importantly, all of the individuals that are delivering vaccines at clinics right across this province, whether it be an appointment-based clinic, whether it be the drive-through or whether it be now the pharmacies that are delivering those vaccines. It hasn't been without its challenges, and the Saskatchewan Health Authority has had to change their delivery system around, which often involves changing the actual logistics of how that vaccine is to be treated in the days in the lead up to the actual vaccination. We would have all liked vaccines, larger numbers of vaccines to be here earlier. We see what that can achieve in other countries, and we want to achieve that as soon as we are able here. But to Scott's point, it isn't going to be the vaccine deliveries in the foreseeable future that are going to test Saskatchewan's capacity. But what will challenge us with the vaccines that we can deliver is people not showing up and choosing to roll up their sleeve and take a vaccine. I can't stress how important that is for all of us to consider getting vaccinated, and in the time between now and the next number of weeks to follow the public health orders that are in place. This is a very, very crucial time in our response to COVID-19, and we're relying on everyone in this province to do what they have done for the last 14 months for just a few more weeks.
That concludes today's update. Thank you for joining us.